Hello and welcome to Meditech's registration module for nursing. Today we'll go over a few of the functions that nurses can perform within registration, including transferring your patient from room to room and discharging your patient from the system, as well as reprinting armbands and other account information. To get to the registration module, we'll start at the Administrative tab, to the Admissions tab, to the Registration Management desktop. Once there, I'll go to these tabs on the right. If my patient is an inpatient, I'll start with an inpatient transfer. Along the top, there are 3 buttons. I'll choose the button that best fits the function I'm trying to perform. If I'm just moving my one patient from one room to the next, I'm going to use the transfer button. I'll enter the patient's name, press enter, and look up my patient, making sure I'm choosing the admitted status. Click right on the patient's name, and I have to fill in the date and time. The date defaults in till today, and when I click into the effective time, it defaults into now. I can always backdate or time to reflect accuracy. Then I come down to current data and new data. The current data is not changeable, and it reflects where my patient currently is in the hospital. The new data is what I'm going to alter. I'll start with service. If my patient is going to remain on the same level of care, in this case a medical floor, I wouldn't need to change the service. But if my patient is going to a different level of care, all I'll need to do is backspace, and I can use this down arrow. I'm going to send my patient to the intensive care unit. Now back arrow again for accommodation. And this more reflects a rate for my patient for charging purposes. I'll now specifically put which room I'm sending the patient to. Actually do have to be in caps in this module. And now which bed I'm going to send the patient to. If the room only has one bed, I'll just put 01. You'll notice that my room rate is already filled in based on the accommodation that I've chosen. The attending physician has already filled in based on the last attending physician. You can change it if you need to. Once I have filled this in, I simply hit save. Now this box pops up allowing me to reprint any new admission forms if I need to with the new room number on it. If I don't need any, I can just hit cancel. And now my patient has been transferred to the intensive care unit within the system. I'm just going to switch 2 patients between rooms. I'll actually use bed swap. I'll enter 2 names in, one at a time here. All their information fills out for me, and it's not asking me to put any room or beds in because in the bed swap, it's just going to change room and bed for me. It does ask the date and time, and if I just click down here, the date defaults to today, and over here, the time defaults to now. I can make a comment if I feel is necessary. Otherwise, I hit save. The reprint admission forms comes up first for Bluebird, which was my first patient, and second for Brown Cow, my second patient, if I need to print anything. The last kind of transfer I can make is the multi-transfer. This allows me to actually transfer 4 patients at one time, which I'll briefly show you. I'll enter up to 4 names at a time. It lists each patient, the room that they are currently in, followed by which room I'd like to put them in, the new room. Once I've filled out the new room each patient is going into, I have to put the date and time. I hit save. And then a box for each print admission form for each patient will pop up. That's the transfer portion of the registration desktop. Now for discharging a patient. You'll use the Discharge tab. Once your patient has left the hospital, you're safe to discharge them from the system. If your patient is an inpatient, then you'll choose that type. If you have a different kind of patient, you'll want to clear that line, use your down arrow, and choose the type of patient that you are discharging. You'll search by name, choose the appropriate account that you are discharging, and double check that you are discharging the correct patient. You'll need to choose the date, time, and disposition that you are discharging the patient. It defaults to today, and if I click over here, the time defaults to now. You can always change the date and time to reflect when the patient accurately left the hospital. For disposition, if I click here and use this down arrow, you may see the options where the patient went to. There is a next button along the bottom for all your options. I simply click on the one option. I can make a comment if I need to, and I hit save. My patient is now discharged from the system. Final portion of the registration desktop is reprinting information. We'll use the Account Info button along the bottom right here, and it's Reprint Admission Forms. You'll simply put in your patient's name, find the patient you need information reprinted on, and put a Y for whatever you need reprinted. So if you need an armband, I'll just come down here and reprint an armband. I hit enter, I need to put in the printer that I want to print my armband on. Once I hit OK, it has sent the information to the printer, and I simply hit cancel out of this insurance form. And that's the end of the registration management desktop. To leave, I simply use the X, the top right, and I'm sent back to the main pathway of Meditech. And thank you.